HMN presents Harari Professionals, a program dedicated to raise awareness and inspire our youth by introducing them to successful Harari individuals.
السلام عليكم ورحمة الله وبركاته. أوركو تزيد كدرخو HMN حجاج زنا قدر زال سلامة زنا يبورد أخو كيلتي سائلنا أوجي لي زالين برنامج بح نتلام ده برنامج زو تبان وأسو إبراهيم عبد الحفيظ.
Assalamu alaikum, everyone. Welcome to our second episode on Harari Professionals, where we aim to connect our youth to successful individuals like Dr. Eman. As always, we hope you follow along and learn some important lessons, especially if you're considering becoming a doctor. Dr. Eman, it's a pleasure to have you.
Wa alaikum salam. Thank you. It's nice to be here, Ibrahim.
Perfect. So I guess my first question will be, can you tell us just a background about yourself, what you do, what your specific field of expertise is, just a quick summary so that everyone can introduce yourself basically.
Sure, yeah. So I am a general practitioner and I work in Australia. So as a GP, especially as a female GP, and also I have a bit of a background in women's health. I do a lot of women's health, so that's across the lifespan. So a lot of so antenatal care, looking after pregnant women. I talk about sort of younger women, about issues that they may be having. Contraception counseling, all that kind of stuff. So that would probably be, I would say, half of what I do when I go to work. And that's all the way up through to sort of menopausal women, postmenopausal women. But then I also do a lot of just general medicine as well. So, lots of kids, lots of mental health, and all of, the challenges that we see in sort of, I guess, Western medicine, a lot of lifestyle disease. But that's, and I work part-time, so I do 3 days a week, and that's enough for me, alhamdulillah.
Many people say that, you mentioned you work part-time. Typically when people think about medical or the profession, it's like a very high intense kind of work, but you're mentioning you're working part-time and you're able to balance the work-life balance. Are you a rare case, or is it common for some people to take a medical route but still be able to balance the work life depending on what their specific need is?
I don't think I'm a rare case, especially in general practice. So the field of medicine I do, general practice in Australia, it's probably one of the best for having and being able to achieve work-life balance. And it's pretty hard when you're a junior doctor, when you're in the hospital system, when you're in like that acute kind of care setting. But once you're out of that setting, it's certainly not unusual. And I mean, like, for example, me, I live 5 minutes from where I work. Like, I'll ride my bike to work when I feel like it. Like, it's pretty good in terms of the balance at the moment. Alhamdulillah, it's good.
Perfect. So what inspired you to become, in this case, general practitioner, doctors in general, but GP in specific? What inspired you?
I mean, like when I finished medical school, I knew I either wanted to do obstetrics, which is like pregnancy care, or general practice. That was kind of the two. I guess the reason I ended up in general practice was more, I suppose, just in terms of life. It's hard to always be on call, working night shifts, that kind of thing. But like, honestly, I love my job now, and I don't have any, so I guess I'm a clinician, so I work with people. Like, I spend all day talking to people, hearing stories, and I'm a very curious person. So it's, ideal job for me to sit there and talk to them, and you're there for them. You help them make positive changes in their life. You help them with their health, when they're, struggling with a medical problem, you're the one there and helping them deal with it. So, I can't say it was what I planned from when I was younger, but certainly now that I'm here, I definitely like it. Can't imagine doing anything else.
Yeah, you mentioned that you had like 2 routes, right? One is just general practitioner, or I forgot the other one you mentioned. Sorry?
Obstetrics.
Obstetrics, yeah, my bad. So like, it turned out that you happen to be a general practitioner, right? Would you say that, having different options to begin with was good because you knew the range that you were to get in, such that if one didn't work, you get the other one? Like, you had 2 options, but then you ended up doing one. Did it just fall in place, or did you plan as this is my first and that's my second, this is my backup? Like, how did you come around having different pathways and then converging into that one?
Yeah. So I'm a big believer in keeping your options open. Like, always keep your options open. Don't sort of close yourself into something, because you're never going to know what it is you enjoy. So try everything. You know, don't put yourself in like a really narrow field too early. So how, I guess, like, both of those options were equally weighted to me when I first got out of medical school. You know, I did my internship, and then as a junior doctor, I did a lot of general sort of rotations. I think I spent about a year doing obstetrics, and I love it. Don't get me wrong. Like, especially I mean, I don't know if you know this, but obstetrics is delivery. Yeah, delivering babies, antenatal care, that kind of thing. The most dramatic type of medicine you will ever do is what happens in the labor ward. When things go wrong, it's super exciting. Like, it's like pretty intense. So yeah, and that's sometimes I guess I do miss a little bit of the drama. But it wasn't so much that it was a backup, but I knew that it would have been a hard life if I'd gone down that road. So obstetrics training is like 7 years, lots of nights, lots of on-call work. And being, I guess, a woman as well, it's the same kind of years where, you know, if you want to have a family, if you want to have children, it would have coincided with all of that. And it's not to say that I won't go back to obstetrics one day. Like, maybe, you know, when the kids are a bit older, or, you know, I'm a bit more settled, maybe I will go back to it. But for this period in my life, I'm doing the thing that suits me best, I guess. Does that make sense?
Yeah, really, really good. And I like how you said, you know, there's one pathway more specific than the other. And so you felt it's probably better to go to the general at the moment, but still it's not the end of it, right? It's not that you reach the end goal. It's still there are potentially other steps you can take if need be, or if the time comes. Yeah, so good. Yeah, good to hear. So I guess the next question would be, you know, what makes you passionate about what you do right now? So I assume you're happy with what you do. You're happy with the job, right? And one aspect is the work-life balance, but also the job itself is something that's, you know, giving you satisfaction. I would think so. So what about it is what's passionate? Like, why do you feel, you know, why do you look forward to this kind of job?
Yeah, because I love talking to people and I love being there for them as well. So I guess, you know, as a GP, like, yes, you do the medical stuff, and that's very, you know, like the mystery of it. Like, you have these, you know, people with symptoms and, you know, working through it, finding out what's wrong with them and treating them. That's very rewarding in and of itself. But also just being there, because you're also their social worker and their counselor and everything for these people. And you really make a difference to their lives. Just, you know, whether it's when you're listening or diagnosing them or helping them with their medical problems, like it people are very grateful and thankful, and definitely it's a very rewarding job. And it's not something, kind of like what you were saying before, it's not something where you're boxed into one field. You're always learning new things. Like, I am not the same doctor I was, you know, 10 years ago, 5 years ago. Every day I'm sort of upskilling, learning new things, going down another path, which, you know, I didn't know if I was going to be interested in, but it's fascinating. So at the moment, for example, I'm kind of upskilling a lot in obesity management and weight management, because it's a massive problem, like, all over the world, and it leads to all kinds of diseases. But that's something that I never really thought of, you know, 5 years ago. But because I've left my options open, that's something I'm exploring further, I guess, and doing further study in at the moment. And then there's all the, you know, I guess it's not specific to medicine, but having independence and autonomy in your work is very important to everyone. Like, it's what makes you feel like rewarded and fulfilled and happy in your job. A lot of it has to do with the level of independence and autonomy you have. And that's not unique to medicine, but certainly where I am now, I do have a lot of that independence. I sort of practice how I want to.
Yeah. I would assume when you think about medicine, you, like me personally, from an engineering background, I can think, there are many examples of where you have that autonomy, there application where you have that autonomy, right? But from looking at a medical's perspective, it looks like, you know, you just, when you want to cure someone, there's just one protocol you follow, there's one method that you have to do. But you mentioned here that there's actually autonomy. Can you just elaborate just very briefly on, the level of autonomy? How do you describe autonomy in medical perspective? Because in one thing, this is medicine, so I think you would follow guidelines, but I would assume there's also cases when you also have to yourself try to analyze and assess. So can you just quickly just explain where that autonomy may come from?
Yeah, absolutely. So I think what you're talking about, a lot of the times when you're at, like in, I guess, specialty medicine would be a great example. So for example, you're, I don't know, the cardiologist, for example, someone's having a heart attack. There is a protocol you follow. There is a way you treat it. Yeah. There's no there's no room for like, oh, let's try something else today. But I think it's very different in general medicine because it's often less of that acute stuff. And we tend to treat the whole person. So we don't isolate them down to, oh, here's your heart problem, here's your brain problem, here's your this problem. We're really looking at the person as a whole. And so when you do that, you're focusing on their mental health, their physical health, their social well, like everything. And certainly you do see different personalities and different styles and different ways of practicing a lot more in the kind of the field that I'm in, as opposed to in that sort of specialty protocol driven, like, this is what we do and this is how we do it type way. And there's a lot of scope for your personality and your style to sort of come into it as well. Does that kind of answer your question?
Yeah, I see that the difference from GP versus other forms of specialty.
Yeah, a lot more holistic. And you choose your approach.
Yeah, I see.
And you tend, the other thing is you tend to sort of, your patient, I don't know how, you tend to collect patients that agree with your style, if that makes sense. So for example, I work in a multi-doctor practice. I practice differently from the doctor next door to the doctor next door to him. And we all kind of tend to accumulate patients who agree with our style and the way we practice, if that makes sense.
Makes sense. I would expect so, because compliance is very important in the medical sense, right? If your patient prefers other methods, then it's really hard to get them on board, right? There's no half and half, right? In terms of medicine, it's like you do it properly or it's not.
It's like they call it the therapeutic relationship. So that relationship between patient and doctor, it's like if you have a good relationship with your patient, that's like they trust you, they'll listen to your advice, they know you've got their back. That's half the battle won, really.
Yeah. Perfect. So move on to the next point. Can you explain your journey in becoming, in this case, a GP, general practitioner? What challenges did you face? How did you push through and persevere? From I would say you began focusing from end of high school to university. So can you just give us just a general overview of your journey and the challenges and obstacles that you have to push through to be where you are right now?
So yeah, in high school, I was never super focused on anything. Like I said, I like to keep my options open. So in high school, probably every term you could ask me and I wanted to do something different. I didn't really know what I wanted to do. But in order to really keep your options open, you need to kind of do well in high school. And sure, like if you want, like for medicine, since that's what we're talking about, there are so many different routes to getting to be a doctor. But if you were to go the most direct route, you need to do well in high school. And that's kind of, at least in Australia, you need to do well in high school to get to the most direct route. So I did lots of different subjects in high school. I tried to keep my options open in terms of whatever it is I would end up doing, and I did my best. So I studied pretty hard, and alhamdulillah, I did well in high school as well. And that allowed me to get to the most direct route to medicine. And I would say, honestly, I probably just fell into it at the time. I mean, 18-year-olds, do they really know what they want to do with their life? Some of them do, alhamdulillah, that's fantastic. But for me, I think I fell into it. But once I started, I really enjoyed it. And that 5 years of medical school was really, it was great. You learn a lot. Your perspective changes on a lot of things. And university in itself is an experience. But yeah, so came out of that. I wasn't sure what I wanted to do. So I spent 3 years, I guess, working as a junior doctor in the hospital system. And that was tough. And I will talk about the challenges I faced in a second. At the end of that, I kind of took a gap year. So I took a year off where I didn't really follow anything in particular, but I was doing a lot of just what we call locum work. So just working shifts all over the place, just experiencing more. And then at the end of that, I started general practice training, and I've been doing that for the last 5 years, and that's been great. So I guess the biggest challenge I personally faced, and I thought was probably the hardest thing about getting to where I am now, with those junior doctor years. And it was tough. Like, that's when you really see, I suppose, the difficult side of medicine. There's the hierarchy and the dealing with difficult personalities and all of those things. And then on top of that, you're a woman. And then on top of that, you're a Muslim. And then on top of that, all these other things you dealt with. I was like, look, you get through it and it doesn't feel that hard at the time, but like, especially now looking back on that, certainly it was difficult. I remember one time I was on like a rotation in a rural hospital. Actually, this is when I was in medical school, actually. I was a final year medical student on a rotation in a rural hospital, so out of the city. And I remember like we were in theatre and this nurse, and I'm pretty sure she was just racist. Like that's the only reason I can put on it. She came in, she's like, all right, we can't take all of you. So she sent me out, she sent another Vietnamese student out, and she left this one white person in. So, and it's just like, what do you do about stuff like that? But I think it's hard, but it's a skill to know when to say something and when to be quiet. And that's a tricky one. It's not helping anyone to create drama unnecessarily, but it's certainly also not appropriate to just be a pushover all the time. You kind of need to speak to someone and stand up for yourself. And ideally someone you can trust and someone who's going to have your back without turning it into a big, I don't know, drama or things like that. And that, it happens so much. Like I remember in emergency as a doctor, there was one doctor who would basically treat all the female doctors like rubbish, pick on everything. And like, I don't want to too much, but I was very competent. Like most of my supervisors were very happy to work with me, and they were actually pleased when I was on a shift with them. But there's always going to be one person. So that's like, I mean, yeah, it's important, I suppose. You're making me remember things that I haven't thought about for a while, but it's important to have your own back, stick up for yourself, speak up when you need to without turning into, something it doesn't need to be. Yeah.
So basically it was just your perseverance, you had to persevere in this case, especially the example you gave when you had to go to the rural area. I also wanted to talk about that point as well. And now in light, because I assume that was 10 years ago, right? You're mentioning to me.
Yeah.
I would assume now that, the idea of now has become more inclusive. I mean, not perfect, but at least more so. Do you think that the experiences you have are something that's very much applicable to the youth coming right now? So our youth who want to become a doctor, let's say 5 years from now, is this something that they should really keep in mind and learn through other experiences? Or do you think it's something that's dying off right now and it's less of an important issue?
I think in the hospital system, anywhere where there's that kind of hierarchy, right? So you know what I mean? Like hierarchy, there is a boss, there are underlings, and you are at the mercy essentially of your boss. That's going to occur. And certainly I hope it's getting better, and it sounds like it's getting better, but it's definitely not something that's going to disappear completely. Because I mean, and that's the other thing I probably should have said, but it's not actually your problem. If people like that, it's not you're not doing anything wrong. It's them that have the problem. And there's always going to be, not just in medicine, but anywhere where that hierarchy exists and there's personalities involved, there will be people who are going to be hard to deal with, who are unfair, who are things like that. And it's really just important to, be resilient, know who you are, have confidence in yourself and have your back, and don't take it when you don't need to.
Makes sense. Yeah. I would say, yeah, as you said, it's not just in medicine, really. This advice goes, far and beyond to other professions. And, I would assume is also more applicable when you have to go to the more rural areas when you leave the city. And I assume medicine, you have to do that a lot, because I was in a previous episode, the Dr. McGuss, he was saying there is a shortage of doctors in the rural areas and not necessarily in the city. And so if you want to become a doctor, and you're looking at a rural area, then that's really much, definitely you could. But as soon as you look at the city, there's a lot of competition. So I'd assume something like in medicine over here, many people would have to do their residency, that is, you call it,
Yeah.
into those rural areas. So they will have to experience it regardless. So yes, that's a good point, just to understand that it's not the same whether you're in the city versus not in the city.
But I mean, I was one of the lucky people. I consider myself lucky, where I only did that 6-week term in rural areas. I've never actually worked in a rural area. So all like my experience with this is in a western suburb, which is where a lot of immigrants live, suburban metropolitan hospital, and it exists there as well. Like honestly, it's not so much the racism, but the hierarchy and the difficult people and having to deal with it. It exists everywhere.
So it's not like they're racist. It's just that they would prefer someone else, and because of that hierarchy, for you to accelerate, you would need to, work much more harder and show much more of a potential, I assume. So it's not like they dislike you, but it's more of like others have more connections and they're therefore able to work through. Is that what it is?
Some people. So I'm just thinking that like the experience, I think it is, I don't want to say don't like, but it is a personality clash. Yeah. And whether that's because of your values or whether it's because of some other reason, if that dynamic exists where you've got a personality clash with somebody who is your senior, it can be difficult. And in my circumstances, it was because it doesn't just happen to me. Like you observe it happening to your colleagues, you see it with other people as well. In my particular circumstances, it's sometimes hard to tease out why it's happening. Is it because of this or that or whatever reason? But it definitely happens, and it happens to everyone. I don't want to put it like, I feel like I'm not going out there saying, oh, I'm a victim all the time. Like it's not that. Like I said, 90% of my supervisors, I would say excellent relationship, but there's always going to be those people who have a problem, and those people, you dealing with them, it's tough because they're your boss, they're your senior, they're the ones who's going to write your recommendations and all of these kinds of things. They're the ones that are going to decide whether you progress in your training or whether you get out of the train. Like all of that kind of dynamic comes into it, and it's really difficult to navigate sometimes.
I see what you're saying. So it's not like that is common, but like it may happen at a point, and that one instance shouldn't be a deterrent for people trying to become a doctor.
Absolutely not. Yeah, absolutely not. That instance and seeing someone like that just tells you about that person. It doesn't tell you about the career path. It doesn't tell you about your colleagues or anyone else. It just tells you that person has a problem. And there are unfortunately lots of big egos in medicine. And so there are quite a few of them. Don't let it be a deterrent, certainly. Because I'll tell you, for every terrible person, there'll be like good ones as well. So yeah, and you often will have mentors and supervisors that you trust more than others, and you talk to them and they'll help you navigate these things as well. I guess it's something that exists, and it's hard, probably the hardest bit, navigating the egos in medicine.
Yeah, so in summary, basically be hopeful, basically. It will happen, but at the same time be hopeful, because the end really is not.
Be resilient.
Be resilient.
Yourself for it. Yeah.
I guess this leads us to the last question, which is, what advice do you have to the future generation, to these Harari youths, particularly those who want to become a doctor? You can talk about in general for those who want a career pathway, but also for those who want to become a doctor. Any tips and tricks you have for them? What advice do you have?
So medicine's great, by the way. So I should just point out, like, coming off the challenges, it's great and it's worth it. And it's something that is definitely a rewarding profession, and you get that independence, and you do get, like, when you get to that light at the end of the tunnel and you're no longer a junior doctor, it is a really great profession. I would say to younger people who are coming in, sort of, firstly, like, dream big. Like, anything is possible. Whatever it is you want to do, if you really want to do it, you can get there. There are many pathways to get to where you want to be. The second thing I probably would say is don't close any doors prematurely. Leave everything open, explore everything, try everything, because you never know what it is that you're going to like until you've tried it. Use the resources around you. So if there are people with experience in something that you're interested in, go and talk to them. And you know, they can often provide advice or help you get somewhere. Like, you know, use your resources, and that's, you know, people resources. So if you know someone, talk to them. Or if you, you know, if you want to look at a career in, you know, a particular field, and you know somebody or somebody knows someone in, talk to them, or organize to talk to them. And then the last bit would probably be like, if at first you don't succeed, try again. There's so many different ways to get to where you want to be. Don't give up hope. Don't be demoralized. You'll get there eventually. And just, I guess, sort of for kids in high school, or like for practical advice, I suppose, it is tough to get into medicine. Yeah. So if you don't do well, you're not going to get there as quickly or as easily as you may like. And one thing which I've learned a little bit more in later life, but having a routine is super helpful. So having a study routine or a life routine, think about what all the things are that you need, and don't forget the self-care, sleeping, like, you know, on time, waking up at a reasonable time, you know, eating healthy, exercise, all of that kind of stuff. But have some kind of routine to your life, and all of those things that maybe feel difficult will just happen.
It's a good point over there where you mentioned, you know, sorry, what was the last point you said? Sorry, it just slipped in my mind. The last point you mentioned.
Eating and exercising.
No, the one before that, right before that.
Having a routine?
Yeah, having a routine, exactly, yeah. So I think because when you're in high school, you know, things are not that straightforward. There are, you know, many other, and I would say also for those having undergrad, so you mentioned transition from high school to medical school, right? I think now, especially in the West, like in America and Canada, the transition is more from high school to undergraduate and then to medical school. And so when you talk about routine, from those in high school, they may not have that much, whereas those who already have an undergraduate degree, they're much more prepared and much more, you know, they're much more organized, right? Does that make a difference, those going directly from high school to medical school versus those who are going from undergraduate to medical school?
I mean, I've obviously not had any experience going to a different, like I did just go straight from high school to medical school. I just, like, you're going to be, I don't know. It's hard to say. But I really can't answer that question. I can't compare it because I've never been through, I suppose, that experience.
Yeah.
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 I mean, people who have gone through postgraduate medicine, like, it didn't feel much different. Like my colleagues or whatever, there's no difference now, but I can't speak to that, unfortunately.
So, like, personally, from my sense, I'm in Canada, and I have some friends who did the same undergraduate with me. I did biomedical engineering, so I know others who did biomedical engineering, but then they are looking to go to the medical route after the undergraduate. And from their, you know, from the 4 years of that undergraduate, they really gained a lot of, you know, they've got that routine, they've got those you know, organization set, and they're really much more, you know, punctual in a sense, and they're very much I would say, like, mature when you compare it to from coming out from high school, right? And a lot of experience as well. Like, if you look at their resume, it's very, you know, very lengthy and very solid. So for them going in, it's much more, I would say, like, they're better prepared of getting acceptance, whereas those coming out from high school, when you compare with these types, it's not equivalent. I would assume maybe because in Canada we have very limited undergraduate acceptance, so the amount of people going into postgraduate medical school, they're just much more skilled in a sense because of the fact that they've already done 4 years and they're able to grasp all these. So I guess it's something you couldn't compare. You can't. It's not like apples and apples, right? It's like apples and pears in a sense.
Yeah.
So,
So I mean, so for me, the undergraduate medicine, it's not difficult. Like it's not, how to say, it's a transition from high school, but I can imagine college would be a transition from high school anyway. And it was like, it's nice to be graduated and you know, ready to start life without thinking about more study at a relatively younger age. And I think especially for women that potentially could be hard, you know, especially if they are planning on things like having a family and children. It can be difficult because by the time you graduate, you finish your residency, I don't know how many years it is in Canada. So certainly there are advantages and disadvantages to both. It's really just what suits you as a person, as an individual, and I guess what's an option. Obviously for people in Canada, that doesn't sound like undergrad medicine option, but here I think there are at least one school in Melbourne I know that still has it as an option, but it is a good option. I wouldn't, you know,
Perfect.
I wouldn't count completely.
Yeah. Thanks very much for the interview, Dr. Eman. It was a
Sorry.
pleasure having you. Very insightful, you know, points you mentioned, and very
sorry,
much.
Can I say
Sorry?
one more?
Oh,
Sorry
yeah,
to cut
go
you
ahead.
off. Okay. I think the other thing, because I assume there are going to be parents watching this as well, and if you, I mean, things that I would probably say to parents, and from my parents' perspective, I guess, a lot of the times I see like parents telling their kids study hard, you know, do well in school, things like that, and I find sometimes I have a young child, so what I'm saying is probably a bit more for young children than older kids, but oftentimes leading by example can be a really good thing. And I remember, like, I distinctly remember when I was in uni, there was a time when both of my parents were actually both studying university at the same time as me. So it's really like when we want our kids to value education or value learning or studying or whatever it is, it's really helpful if we can, I suppose, also show a love of learning. And that doesn't mean everybody has to go to university or everybody has to, but just looking like a person who's interested in learning things and educating yourself. You know, I think I read somewhere, this is not so much about like Western education, but about one way of getting your kids to love the Quran, for example, is showing them that you love the Quran. So letting them see you reading it and letting them see you have a relationship with it. And I think that would be a kind of similar thing to also translate to Western studies as well. Doesn't mean like, you know, every parent has to be a doctor for their kids to be a doctor, but just showing like that education is important and learning is important in some way, even if it's a small way, even if it's just sort of taking interest in their studies or, you know, more than have you done your homework, but, you know, what are you learning about? Can you tell me about it? Oh, that's really interesting. I feel like that potentially could be beneficial, especially for children who are raised in, I guess, a Western environment. Our attitudes are maybe a little bit more different from what you'd expect back in Ethiopia. So having a parent who shows by example may be a useful thing, I guess, to encourage them.
Perfect.
Don't know how teenage. I think flips that parents have less of an influence after that.
Yeah. What I've also noticed is on the flip side of things is some, like, not that common, but I do hear from some youth saying, "Oh, my parents are very much, academic oriented. So they're like, you have to study from this time to this time, and you have to get this much, you have to get a graded not below such and such and the likes." I guess that would be the other extreme, right? So you were mentioning parents who are more lax, that they need to also be a role model. Do you have an advice for those who are maybe very much attached and they really want their child to succeed, but sometimes are overdoing it? Does that even occur? Do you have experience with that?
Yeah. My personal experience, no. I think I was a very self-driven learner from a young age. Like I liked learning. I was, I think I can safely say now I was a bit of a nerd in high school. So that, it is what it is. And it worked out well for me. But I think every child is born with a certain capability. And as parents, we really want all of our kids to reach that capability. There's nothing worse than seeing someone who's very capable not fulfilling that capability. But I think we do have to recognize their capability. And so if a child is capable and is not doing work because they're not motivated or this or that, we need to find ways to motivate them and keep them engaged with learning. The question you were asking about, and I mean, look, kids should we all know when we're not doing our best. Like, let's be fair. Like, we know when we're not giving it our all and doing our best. And if we're not, then we should try to give our best to everything we do. But as a parent, maybe recognizing why kids are not doing their best rather than just, I don't know, keep telling them the same thing over and over again, disciplining, things like that. Maybe looking at what's motivating them or not motivating them would be helpful. Allahu A'lam.
Perfect. Yeah, so that was a great comment over there. So overall, as I said, we're very good, insightful discussion. A lot of things that I've learned. I hope also the audience will learn a lot too. So Jazakallah khairan for that. It was a pleasure having you, Dr. Eman, and I hope everyone can benefit from it. And Jazakallah khairan for attending. Assalamu alaikum wa rahmatullahi wa barakatuh.